Hi, this is Dr. Davidson. I just wanted to take a second to explain what we're trying to do here to keep you safe at Waters Davidson Family Dentistry. We've taken a lot of time to research and find the best ways to protect you and to protect us, and your appointment will look a little different this time than it has in the past. I thought it might make you feel more comfortable if you could see a little bit about what that would be like before you show up for the first time. Some of you are aware of our patient portal, and we are sending out emails to remind people and give you another chance to sign up. That allows you to do all of your forms before you come, and that really will cut down on the time of your appointment and the cross-contamination possibilities in your appointment at our office. So be looking for that email so you can set that up and have everything ready before you come to make your life easier while you're here. Our pre-screening questions will happen before your appointment. We have to have those answered before you walk in for your appointment. Know that our waiting room is closed for patients right now. So when you come to your appointment, you will call a number that's sent out on your text message and your email, and it's also written on the door in case you need that. And one of our smiling staff will come take your temperature and let you in our building, and we will go over those questions again to make sure that you're healthy and safe to be in our practice, and that will keep everyone in the practice safe. Hopefully the wait in your car will be short, but please be patient with us while we work through the logistics of making sure that everyone gets checked in properly and has the time that they need. One of our important things that we're implementing is a virtual exam, and we're doing that for a lot of reasons. I'm really excited about it because it limits exposure to our patient, but also to our practitioners. The clinicians that work here and work so hard to keep you safe and healthy, I think it's really important that we are protecting them and that we're protecting you. And the personal protective equipment that we want to use to do that is scarce right now. In a bid to preserve that protective gear, one of the things that we're going to do is that virtual exam. So I want to show you a little bit about what that looks like. In that virtual appointment, the dentist will sit on an iPad that you will most of the time be able to hold in your lap so you can see each other really well. And the virtual exam is a camera that goes into your mouth with the hygienist's help. So the hygienist is going to show the dentist areas of concern or things that they were worried or uncomfortable about. And they can actually have a conversation about a tooth in real time. That camera has some pretty amazing technology, really clear images for accurate diagnosis. And that iPad allows the conversation to be able to happen right then, as opposed to rescheduling and having an exam at a later date. So your appointment will start in hygiene. Images will be taken that the dentist will review and go over. So when in the appointment it's time to talk to the dentist, we will, from your chair, call usually Dr. Waters, and he will have already looked at documents and x-rays and images that were taken already. So he'll have that information at his fingertips, and then the conversation about what might have been uncovered today. And sometimes we'll take some time and video a particular tooth where there is more of a question in that appointment, and then a treatment plan will be agreed upon, and we'll be able to do that virtually as well. With the use of those same iPads. We're making every effort to make cross-contamination as low as possible, so we will make every effort for a touch-free checkout. What that means in your appointment could be you filling out your own appointment card, or a phone call for payment at the end of your appointment. It could mean scanning your card in the chair so that you don't have to stop at the front at the end of your appointment. It also means that treatment plans will happen in a different way. So if there are questions that need to be answered about insurance, we'll take the time to do that, and then sometimes schedule or set up a separate phone call with our treatment plan coordinator so that we can make sure that you're comfortable and understand what we know about your next appointment. I'm really excited that we could invest in this technology in order to keep our patients and our staff safe right now. I'm really excited that you'll be able to get your questions answered while you're here and you don't have to come back for another appointment. And I'm really excited that that means you're safer and that we are safer too. Once again, we've been working really hard during this time to make sure that everyone has the ability to be healthy and safe, and we really appreciate the patience that you've given us. Please know that we are really excited to get to take care of you again, and we're working hard to make that experience as pleasant as possible for you. Thanks.